That's been a little bit.
Thanks for filling out your form in the waiting room. The PHQ, as you're pretty used to by this point.
Yeah.
So it's been, I guess, off and on a couple of years that we've been seeing each other.
Yeah.
Sometimes more frequently than others.
Yeah.
Yeah. So you might remember when we first started doing the PHQ depression scale.
Yeah. It wasn't. Yeah, it was a little while ago.
It wasn't too long. We're now also implementing a new protocol for making sure we're doing a really good job assessing for risk of suicide.
Okay.
So you get to be one of the first people to experience that. So I'd like your feedback on it.
Okay.
But the idea is, I think you're the perfect person for it because I know that suicidality and having thoughts of death and dying and thinking about how you might do it is something you've been dealing with for almost your whole life.
Yeah.
Yeah. So, and, well, some think that that's sort of just standard and for the case, and including myself sort of for a long time. There's a new movement that's about, actually, if somebody's thinking about suicide that much, that needs to be the focus of treatment.
Okay.
Okay. So you're going to notice, like you noticed when we started implementing the PHQ in the waiting room, you're going to notice a little shift as well, the focus moving towards assessing suicidality and focusing on managing suicidality and doing that kind of thing.
Okay.
Essentially, if you're my client and I'm not spending time focusing on that, I'm almost saying it's okay for you to feel that way.
Yeah, I guess.
And it's absolutely not okay for you to feel that way. I know you felt that way for a long time.
Yeah.
But I want you to know that I have hope that that actually can be different.
Okay.
And I really would like to focus our energy on moving in a different direction.
Okay.
Okay. So what I'm going to do is this really standardized risk assessment that involves yes/no questions. And we've talked about suicide before, but you'll notice this is going to be pretty different because it's very direct.
Okay.
Okay. I'll follow up with other questions later, but I want you to know what's most important here is that you feel like you can answer truthfully,
Okay.
and know that I'm really willing to work with you to manage whatever thoughts you're having about suicide.
Okay.
Okay. Do you have any questions to start with?
No.
Okay. All right. So this is our suicide risk assessment form. You'll see it's very nice and guided.
Okay.
And so what I'm going to do is follow this form to make sure that I'm asking the most important questions.
Okay.
So we'll start with some yes or no questions.
Okay.
And I'm going to ask you about the past month because this is the first time I've ever used this scale with you.
Okay.